10 urgent signals your feet warn you of diabetes. Imagine your feet as silent messengers, whispering secrets about your health that you might not even suspect. What if those whispers were trying to warn you about something as serious as diabetes? Welcome to this eye-opening journey where Dr. Healthy, a seasoned medical expert with years of research on human health, especially diabetes, unveils the hidden clues your feet might be sending you. This video is packed with invaluable insights that could change the way you view your body forever. Curious yet? Stick around until the end for a wealth of knowledge you won't want to miss, and if you find this helpful, don't forget to hit that subscribe button. Let's dive into the fascinating world of foot health and diabetes. 1. Numbness or tingling, the silent alarm. Have you ever felt a strange pins and needles sensation in your feet, as if they've fallen asleep for no reason? This could be more than just a quirky annoyance, it's often the first whisper of diabetic neuropathy, a nerve damage condition tied to high blood sugar levels. Over time, elevated glucose can fray the delicate nerve fibers in your feet, leaving you with this unsettling feeling. But here's the kicker, it's not just discomfort. Persistent numbness can dull your ability to sense heat, cold, or even pain, putting you at risk of injuries you might not notice until it's too late. As Dr. Healthy, I've seen patients ignore this sign, only to discover cuts or burns they never felt. Take Sarah, a 45-year-old teacher I once treated. She brushed off the tingling for months until a small blister turned into a severe infection, all because her nerves couldn't sound the alarm. The lesson? Don't dismiss the whispers. Check your feet daily for unusual sensations. Keep your blood sugar in check with a balanced diet, think leafy greens and lean proteins, and consult a doctor if the tingling persists. Early action can slow neuropathy's march. 2. Swelling in feet and ankles, a circulatory SOS. Picture this, your feet and ankles puff up like balloons by the end of the day. While it might seem like a harmless quirk, in the context of diabetes, this swelling, called edema, could signal trouble. High blood sugar damages blood vessels over time, slowing circulation and letting fluid pool in your lower extremities. Add kidney strain into the mix, and you've got a recipe for persistent puffiness that's more than skin deep. I recall John, a 52-year-old truck driver, who thought his swollen ankles were just from long hours on the road. A diabetes diagnosis revealed the real culprit, poor circulation and early kidney issues. With lifestyle tweaks like elevating his legs and cutting sodium, he turned it around. Reduce swelling by staying active, simple ankle rotations work wonders, and wear compression socks. Monitor your blood sugar religiously, as stable levels keep your vessels happier. 3. Slow healing sores, a healing hurdle. A tiny cut or blister that lingers far too long isn't just bad luck, it's a red flag for diabetes. High glucose levels clog your circulatory highways, slowing the delivery of oxygen and nutrients needed to heal. Toss in a weakened immune system, and even a minor nick can spiral into a serious infection. Take Maria, a 38-year-old mom. A small scrape from new shoes took weeks to heal, eventually landing her in the ER with an infection. Her undiagnosed diabetes was the silent saboteur. She learned to inspect her feet daily and keep her sugar levels steady, a game changer. Wash cuts with mild soap, apply an antibiotic ointment, and cover them up. If healing stalls beyond a week, see a doctor. Prevention beats cure every time. 4. Dry skin and cracks, beyond cosmetics. Cracked heels and dry skin might scream for lotion, but in diabetes, they're a deeper issue. High blood sugar dehydrates your body, leaving skin brittle and prone to fissures, painful gateways for bacteria. Neuropathy can worsen this by throwing off your skin's moisture balance. I once advised Tom, a 60-year-old retiree, whose cracked heels kept him up at night. Moisturizing with urea-based creams and stabilizing his glucose transformed his feet, and his sleep. Hydrate inside and out, drink water and use a thick moisturizer daily. Check for cracks, especially around heels, and treat them before they invite trouble. 5. Cold feet, a chilly clue. If your feet feel like ice blocks even under cozy socks, don't just blame the weather. Diabetes can choke blood flow to your extremities, leaving them cold. Neuropathy might also trick your brain into sensing a chill that isn't there. Lisa, a 49-year-old nurse, laughed off her cold feet until a checkup linked it to her prediabetes. Warm baths and regular walks boosted her circulation and her comfort. Keep moving, try a 20-minute walk daily, and soak your feet in warm, not hot, water. Control your glucose to thaw out this symptom. 6. Skin color changes, a visual alert. Red, blue, or pale feet aren't just quirky, they're a window into your vascular health. Poor circulation from damaged vessels can tint your skin, signaling oxygen shortages or inflammation. In diabetes, this isn't trivial, it's a call to action. Mike, a 55-year-old mechanic, noticed his toes turning bluish. It was a wake-up call to his unmanaged diabetes. With medication and better diet, the color, and his peace of mind, returned. Note any color shifts and talk to your doctor if they linger. A nutrient-rich diet, think berries and nuts, supports vessel health. 7. Hair loss on feet, a subtle sign. Losing hair on your toes or legs might seem minor, but it's a circulatory clue. Diabetes can starve hair follicles of blood, stunting growth and leaving your lower limbs bare. I've seen this in patients like David, a 47-year-old chef, who shrugged it off until his diabetes diagnosis tied it to sluggish blood flow. Small changes, like quitting smoking, helped. Don't ignore this quiet hint. Boost circulation with exercise and keep glucose steady to nourish those follicles. 8. Pain when walking, a movement warning. Ache or cramps while strolling. This could be claudication, pain from poor blood flow to your legs, a diabetes hallmark. Neuropathy might amplify it, making every step a chore. Emma, a 50-year-old hiker, cut her treks short due to leg pain. Diabetes management and physical therapy got her back on the trail. Stretch daily, manage your sugar, and consult a specialist if pain persists. Movement shouldn't hurt. 9. Foot shape changes, a structural shift. If your feet start looking unfamiliar, arches flattening or toes curling, it's not just aging. Neuropathy can tweak muscles and alignment, skewing your foot's shape and hiking ulcer risks. Paul, a 53-year-old carpenter, ignored his shifting arches until calluses turned sore. Custom insoles and glucose control saved the day. Wear supportive shoes and check your feet silhouette regularly. Early tweaks prevent big problems. 10. Fungal infections, a persistent pest. Itchy, red skin between your toes. Diabetes fuels fungal growth by sweetening your body's environment. Slow healing and dulled sensation make it a stubborn foe. Anna, a 42-year-old baker, battled athlete's foot endlessly until she tackled her sugar levels. Foot powder and dry socks became her allies. Keep feet clean and dry, use antifungal creams, and monitor glucose. Fungi hate a healthy host. Your feet are more than just a means to get around, they're a health dashboard, flashing warnings about diabetes you can't ignore. From tingling toes to fungal foes, these signs demand attention, and now you're armed with the know-how to act. Share this video with someone who needs it, drop a like if it clicked for you, and comment your thoughts below. Have you spotted these signs? Most importantly, subscribe for more life-changing health tips from Dr. Healthy. Let's keep learning and thriving together. See you in the next video.